Here in New York, our next guest says that for starters, the government shouldn't run the healthcare system. Dr. Robert Glassman, a private equity partner at OrbiMed Advisors, the world's largest healthcare dedicated investment firm, approximately $5 billion in assets under management. Dr. Glassman is also a clinical professor of medicine at Weill Cornell Medical College, so you're speaking as an insider. Yesterday, New York Senator Chuck Schumer said the number one thing healthcare legislation has to do is cut costs, and yet that appears to be the last thing it does at this point.
Yeah, what's amazing is that we've gone from cutting costs to pay for health care to trying to pay for health care. And over the last week, there's been a huge number of options that have been bandied about. Tax the rich, tax employers who offer health care insurance, tax employers who don't offer health care insurance, create health care cooperatives, tax people over $250,000 in earnings, tax non-wage income. It's crazy, and all these ideas have been imprecise, chaotic, and without details.
Atul Gawande, the Harvard doctor who writes in The New Yorker, said recently that the incentive structure in American healthcare is the problem, that every individual actor along the way maximizes their own profit, and the legislation really isn't addressing that problem, is it?
I think the legislation is basically without details. Right, people want to maximize their healthcare outcomes at the right cost. Doctors want to maximize their profits. Drug manufacturers want to maximize their profits. The government wants everybody to be insured. So we're all having these great intersections here, but nobody seems to have a solution that makes any sense.
Well, Lizzie was just talking about the healthcare co-ops. The woman from the co-op said that they put the patients first, and that helps lower costs. Do they work?
Well, that's very nice. It's just one of many systems that have been in the market for 60 years. Basically, healthcare cooperatives are just an autonomous collection of people with the common purpose to purchase and manage their healthcare. Sometimes they buy doctors and other providers and hospitals. Sometimes they don't. The most common one, the most famous one, is the group health system at Puget Sound in Washington, which has been around for 60 years, and is responsible for somewhere around 9% of health care in Washington. These things have not retained costs that well. Some have done better than others. They're not that dissimilar from HMOs or health maintenance organizations. So this is not a wow sort of idea to manage healthcare costs.
I got only about 20 seconds left. It looks like there, at this point, isn't a lot you can invest on. People seem to be betting more on against ideas.
Well, you know, it's funny is we're spending all this time dealing with healthcare when the economy is having some problems right now. Ben Stein, I think, gave a great talk, had a great speech yesterday where he said it's like a plump man getting hit by a truck, and the plump man is, while he's getting his trauma taken care of, he's also getting plastic surgery, coronary bypasses, and all the other stuff.
A little much.
It's a bit much all at once.
All right. Dr. Robert Glassman of OrbiMed Advisors.